I'd like to introduce Dr. Jill Cottel from California in the United States. Thank you for joining me, Jill.
You're welcome. My pleasure.
Could you tell us who you are and what you do?
Sure. So I have a general internal medicine practice in California. We're in North San Diego County in the city of Poway, and I am a solo practitioner with a private practice. I'm board certified in internal medicine and practicing now for about 20 years this year, and with a focus on integrative holistic medicine. In 2007, I joined what is now the Academy of Integrative Health and Medicine and became a diplomat of the American Board of Integrative Holistic Medicine. So in my practice, I really take a whole person approach to treatment.
So tell us, when did you first hear about LDN?
So I first heard about Low Dose Naltrexone in summer of 2008. And I had a patient who was 77 years old at the time, and she had come in, and her daughter had had an excellent response using LDN for rheumatoid arthritis. And so my patient was interested in taking it to see if it would help with her immune system and help to treat her asthma and allergies, which she was having a lot of trouble with and having to take several medications regularly. So she brought me a lot of paperwork that she had printed out, and I read through it all, and mainly was looking to make sure it seemed like it was safe and wouldn't be harmful. And I felt it would be safe, so I agreed to write her the prescription. And she came back about 6 months later just for her regular checkup. And it turned out she was then off all her asthma and allergy medications, and she was feeling very well and looked great. And actually, she has been taking it since then and is still doing quite well.
Mm-hmm. That's an amazing story.
It is.
Did you then start prescribing it for all your patients?
No, I really didn't think about it very much past that. The reading that I had done when she'd come in was mainly regarding using it for multiple sclerosis. So it wasn't until about 2011 I had an interesting case where a young man came to me, and he had an episode of double vision and had seen a neurologist and had a very abnormal MRI of the brain with several lesions, and he was diagnosed with a demyelinating disease and was told he had a very high risk of developing full-blown MS. And so the neurologist offered him the standard conventional treatments for MS, and the patient did his own research, and in thinking about the potential side effects, he decided not to pursue that at that time. So he came to me and was asking about any possibilities for a holistic or alternative treatment approach. And I remembered the reading that I had done from 2008. And so I started him on LDN and followed him very closely. And each time I saw him, he was improving. And we had interval MRIs that were slightly improved each time. And then his MRI of his brain that he had at 2 years was read as normal. And I thought, well, surely there's some mistake. So I called over to the radiology department and spoke with a different radiologist, and he looked at the films and he said everything's normal. And I said, okay, well, let's make sure it's the right person. Pull up the films from 2 years ago, and he pulled them up and said, yes, I see the brain lesions. I'm looking at the current MRI. The current MRI is normal.
Wow.
And it was really remarkable. And just being able to see firsthand the kind of results that you can get using LDN. But still, even at that point, I wasn't thinking about using it outside of MS. Well then, so last year, as part of a board recertification process, I had to write up and submit a case report. And I chose this particular case because it was so interesting. And in the course of doing the case report, I did a literature review on low-dose naltrexone. And there was so much information available about LDN, much more than I had remembered from the previous time. And the more I read, the more interested I became. And I read through case reports, studies, I read through patient testimonials, and learned the science behind it, the basic biochemistry, the biology, and learning that there's so much that we do know now, which cells in the body it affects, which types of receptors, the cellular pathways, and understanding that treatment with LDN is really founded on basic science, clinical evidence, and really years of physician experience working with patients with LDN. So after that time, I decided I was going to start considering it as a treatment option for patients who had problems that were other than MS when it was clinically appropriate and there seemed like there could be a potential for benefit. And since I have a general internal medicine practice, I see a wide range of different types of problems. And so over the past year and into this year, I prescribed it for many different conditions, and the results have been overwhelmingly positive.
You said to me that you had done a survey. Have you got the results of that survey?
Yes. So since I knew that we'd be talking, I have been keeping a record of all my patients that I've prescribed it for. And right now I have somewhere over 50 patients taking it for a variety of different problems. And different categories that are related in terms of having some sort of immune system dysfunction or inflammatory component, really a wide range of diagnoses. I have some who are taking it for autoimmune joint problems such as rheumatoid, lupus, psoriatic arthritis, mixed connective tissue disorder, Sjogren's. Some taking it for autoimmune gastrointestinal problems like celiac disease, ulcerative colitis, collagenous colitis. I have a few patients for asthma and allergies, some patients with different types of nerve disorders, and of course patients with fibromyalgia or chronic pain. And so I contacted about 3/4 of my patients who are taking it right now, and I had them rate their response to the LDN. And I gave them a scale, and 1 through 5, with a 2 being no change, 3 being a slight improvement, 4 being some improvement, and 5 being much improved. And it was very interesting because I knew that people were responding well and doing well, but when I took the actual numbers, the numbers turned out that 89% of patients were reporting at least some improvement, which is a very high number.
Mm-hmm.
And of those patients, the number of patients that actually gave me a 5, so they were much improved, came out to almost 1/3 of these patients.
Oh, wow.
Yeah.
Mm.
So it's very exciting.
Yes, very.
So that's been fun.
So what would you say to other doctors who are thinking of prescribing LDN for their patients?
I would say that depending on the type of problem that the patient has and knowing the patient, that low-dose naltrexone should be considered when there is a possibility that might benefit, especially for autoimmune type problems or inflammatory type problems where it seems like there might be benefit because it's really so low risk in terms of side effects. And there has been many years of experience of other doctors using this medication.
Oh, that's really quite something. It's amazing results that you've had there.
It is. And in this country, it's FDA approved at the higher doses, 50 to 100 milligrams. And so we're using it off-label. So it's got all the safety data that we need to feel comfortable using it.
So what's your plan now, Jill?
I'm excited to go on with these patients and see how they do the longer that they take the medication. Seems to be the patients who have more inflammation respond most quickly. I've seen some patients within a month having benefit. Other patients who have more non-inflammatory type problems, whether it's nerve or non-inflammatory pain. It's taking a little bit longer, a few months, to really start to see the benefit. But as time goes on, they continue to show improvement. Some of my patients, even 5-6 months out, noticing quite a bit of benefit that they weren't noticing the first few months.
So from your experience, dosing-wise, I'd like to discuss with you. Do you suggest daytime dosing, nighttime dosing? How do you go about dosing?
That's a good question. I have typically been dosing it at bedtime, but in patients where I know they are already having some issues with sleep, I will actually prescribe it in the morning. And I haven't really seemed to notice a difference between the patients who are taking it at bedtime and some in the morning. Now, some patients at bedtime are saying, well, it's the first time they've had pain-free sleep, in a long while. Mm-hmm. And others, it might be causing a side effect where they get the vivid dreams. Hasn't been an issue for most patients. Either that's passed, or if it hasn't, we moved it to morning, and then it wasn't an issue anymore.
And you say about the vivid dreams, that brings me on to my next topic of side effects. Have you noticed anything other than sleep disturbance or vivid dreams?
Right. So of the prescriptions I've written, which has been a little over 60 now, we've had about 6 patients stop. And 2 of them, it was because they'd been on long enough and hadn't noticed a change. The other few, mainly for sleep issues. And I did have one patient who is perimenopausal, who her period resumed, mm-hmm. which was not something she was happy about.
So what about pain relief? That's always a question that people ask. What can I take alongside of taking LDN?
Mm-hmm. That's a good question. Most typical pain medicine should be fine. Acetaminophen, anti-inflammatories. It's come up a question, what about tramadol? I think tramadol really should not be a problem as long as it's dosed enough apart from the LDN, I would say 4 hours at least. The short-acting tramadol. Long-acting tramadol, I think, is a different story. I probably wouldn't use that with it. Mm-hmm. And that would go for other long-acting pain medications, would not be appropriate. But the short-acting pain medicine, if you have a patient who has a flare and they really need something for pain, if it's far enough away from their dosing on the LDN, I don't think it should be an issue, as long as it's short-acting. I did have one patient where she had a flare and she really had to take a pain pill. And she had been taking the LDN at nighttime, and this was during the day at some point. And she did take one of her pain pills, and it did give her some relief. And the interesting thing was she didn't get the drugged feeling that she would normally get with the pain pills, and that was a good thing for mm-hmm. her.
Well, definitely. So have you noticed anything else, as in drug interactions with any other medication?
I have not.
Oh, that's good. I'm just trying to think of the other questions that people ask. Talking about this lady who's started menstruating again. LDN does help with a lot of women's problems, so that's something else that I'm sure a lot of women would be interested in finding out more about. And we discussed last night about how LDN is also being used for psychologists are using it and psychiatrists. And you probably heard Dr. Mark Schuckman speaking at the conference in Las Vegas, how he uses LDN in his practice, and it's very interesting. It isn't just, like you were saying, MS or even fibromyalgia or rheumatoid arthritis. The list is quite considerably long now. I think there's 178 conditions that we know of that LDN can treat. Many have an autoimmune component there. Well, all of them probably.
Yes, yeah. That was very interesting. And I've seen as a side effect for my patients taking LDN, most of them feel better. which I think may be an effect of the increased endorphin levels. They just have an improved sense of well-being. And I have a few patients taking it for different types of mood disorders where the traditional medications really haven't been effective, and they've found it quite beneficial. So
it's amazing, isn't it? It's very interesting.
And when you look at so many of the chronic illnesses that we treat on a daily basis, really at their heart have chronic inflammation and immune system dysfunction as the basic problem. And so LDN gives us a tool to go after that and really treat the root cause of the problem instead of just treating the symptoms or the end diagnosis, if you will, which is exciting.
Very exciting. And if you can halt it early on, like the case study that you were talking about, that the lesions had gone and the MS wasn't going to become full-blown, you managed to stop it. I mean, how amazing would it be if people on diagnosis started LDN immediately? Right.
There's so little downside to starting it. And if more people knew about it and it could be started earlier on in the course of problems, I think people would, if they respond, wonderful. It's great. It's very inexpensive, low risk of side effects, and certainly save a lot of time and, unwanted side effects with other treatments.
Yes. Thank you very much for sharing your experience with us.
You're welcome.